Hey, how you doing? I'm doing good. I'm here to assess you today. How you feeling? I don't want to be here. I just want to kill myself. What? I want to die. Die? Yes. You can't do that. You want to kill yourself. We don't do that here at Francis Mary Hospital. I just want to die. No, you have to at least try the treatments because killing yourself is, no, you're not allowed that. Or can you just keep this between me and you, please? Of course. I'm always loyal to my patients. I mean, you can always trust me. You know? Thank you so much. I appreciate it. You're welcome. I'm going to put you something. You need anything? No, ma'am. Can I find the Thomas family?
Yes, how's my baby doing?
Okay, y'all take that. Y'all can take a seat. I'll tell y'all just a second, okay?
I'm really worried.
I don't know if a doctor has came and talked to you yet, but Khadija had stage 4 pancreatic cancer. We caught it. She didn't come in early enough, then we caught it, and it's untreatable. But she wanted to kill herself. She's wanting to kill herself.
You can't let her do that.
She wants to. She's being irrational. I think she needs
You
psych
can't
help.
let her do that.
She needs psych help. Something's wrong.
No, we can't do this. We can't let her do that. Hey, Miss Thomas, I'm Dr. Sigmund.
Dr. Conyers.
I'm your nurse, Maggie.
And I'm your nurse, Ashley.
And do you understand your diagnosis?
No, ma'am.
You've been diagnosed with stage 4 pancreatic cancer, and at this point, it's not curable. But there are treatment options. We have chemotherapy and palliative care. With the palliative care, we would just make you comfortable until you die.
Is there another option to where I can die faster?
Well, we could always do physician-assisted suicide, where I would write you a prescription for secobarbital and pentobarbital, and then at a time of your choosing, you would take those 2 drugs and you would fall into a deep sleep, and then you wouldn't wake up.
Well, I'll take that option.
Miss Thomas, in order for consent, we need to have witnesses. Your family is in the hall if you'd like us to go get them.
I don't want my family to know my decision right now.
But see, you need your family in your corner. They're going to be the ones that are there for you, and they'll understand you. They'll understand. Don't be scared to tell them.
Okay.
Can we get them?
Yes, ma'am.
You need me to do anything else?
Alright.
Okay.
We'll be back with your family.
Miss Thomas, are these going to be your witnesses today?
Yes, we are the witnesses.
We are. Okay, well, I have your paperwork if you could just sign for me.
I accept full responsibility for my actions and I understand.
Okay? So everybody, let's give Miss Khadija a hug.
We're gonna miss you.
My baby.
As we've been showing you this morning, 29-year-old Brittany Maynard is starting a national conversation about choosing the way to die. Maynard has terminal brain cancer. She moved to Oregon, where doctors are allowed to help patients end their lives. In her first television interview, Maynard explained her choice to Jan Crawford.
I don't want to die. If anyone wants to hand me like a magical cure and save my life so that I can have children with my husband, you know, I will take them up on it. But we haven't been able to find that. And the way that I would die, just according to this disease, is terrible. The availability of being able to take a medication that allows me to slip into a sleep in 5 minutes and pass away most likely within the half hour sounds a lot better to me, just as a human being.
And Dr. Agus, there are currently only 5 states where aid in dying is legal. In those other states, what does the medical community offer for patients like this who are terminally ill?
Well, we can alleviate many, if not most, of the symptoms of advancing cancer. And we can take away pain, we can take away, symptoms that you may have. But at the same time, we can't restore dignity. And it's very important to distinguish those two. You know, I look at the Brittany story, and again, she's a hero for what she did because she brought this to the national discourse. But I look at it as an indictment, a failure of the medical system twofold. One is we can't treat this horrible cancer. And the second is she and most cancer patients don't trust physicians to be able to alleviate most of the symptoms at the end of their life and restore dignity till the dying process.
So knowing what you know, if you were a doctor in Oregon and she came to you and said, this is what I want to do, what would you tell her?
Well, first I'd go through what I could do to alleviate her symptoms, but it is her value system, and my job is to educate her with the facts, and then she makes the decision based on her value system. It's not the role of the physician to tell a patient what to do. It is a partnership, and based on her value system and what she believes in, she needs to make the right decision for her.
And then the day came, November 1st. What do you feel comfortable sharing about that day? The day started with a seizure from her, did it not?
A small seizure that morning, and we decided to sleep in a little bit longer. After that mild seizure, her speech was very kind of garbled.
Was there an acknowledgement that this is November 1st?
When we woke up that morning, there wasn't any sort of heavy feeling or cloud looming, a dark cloud type scenario. It was like, well, what are we doing today? We'll have breakfast. The house was full of her friends. My younger brother was there, her parents, and okay, we'll have breakfast. Let's go on that hike that we want.
So you did the walk with the dogs and you came back and...
I guess she just knew that it was her time, that the seizure that morning was a small reminder. She would talk in terms of she knew what she was risking. If a seizure comes, or worse yet, a stroke, and that affects her ability, her motor cognitive function, that she cannot self-administer because the patient has to drink, you know, it's 4 or 5 ounces of medication. And that was a real fear. She would be trapped in her own body, and she would then be forced to die exactly the way that she was trying to avoid. And so there's the process, the preparing the medication, and
she did all this herself?
no, you know, the doctor had laid out the instructions on here's she'll take these about an hour before, and that just kind of settles the patient's stomach. There's another one that's taken like 30 minutes before. But during that whole time, you know, there's conversation and everybody's sharing stories, and it is very tranquil. It was, the mood in the house was very peaceful, very loving. She even asked, you know, tell me about a memory that you have, or tell me, to the people in the room, to her friends. And I think there was 7 people total in the room. And Bella, the little dog, was there in the bed with Brittany and I. Charlie, of course.
You were in bed with her?
Oh, yes. I was right next to her. And her friend, that is a physician, was there. The medication, we brought it in, and then when she was ready, she actually wrote on Facebook a message to her friends and said, "I love you" to everyone, to me, and she drank the medication. Within 5 minutes, she fell asleep. Very, very peaceful. Within 30 minutes, her breathing slowed to the point where she passes away. And it's the most peaceful thing that you would ever expect or even want. When I saw that, the first thought that I had was, if I live to be 100, I don't care what I'm suffering of. I'm like, that's what I want. I want to go that way. It's what people, they always say, oh, I'd prefer to die in my sleep. Not even aware of it. That's exactly what Brittany got. So, yeah, her passing was truly peaceful. And the thing that makes me feel okay as well as her parents and her family, is that she was in control of it. A determined individual who planned and thought everything through.
It feels to me, Dan, like you're proud of her for that.
Absolutely.
Mm-hmm. Mm-hmm.
Yeah.